So ain't nothing wrong, okay?
Hello, and welcome to today's episode of the Black Scientists Cooperative. Today we have a very special episode, special edition episode in honor of Earth Day, with a very special guest, an environmental scientist by the name of Michelle Madison. She has done some extraordinary things in her life, and we are so happy to have her on as a guest today. And we're going to have her tell a little bit about herself. So Michelle, can you give our viewers a little bit of background on yourself? Tell us about your journey to becoming an environmental scientist.
Yeah, again, happy to be here with you lovely ladies. So yeah, it's been quite the journey. And I would say, I guess starting off, I grew up in a small sort of suburban rural community in New Jersey, but a lot of my family grew up all around the country, but a lot of them are in Tuskegee, Alabama, as well as Durham, North Carolina. So all up and down the East Coast. I would say a lot of my passion for this work comes from seeing sort of a legacy of this work in my family. So my grandparents met at Howard University, which I am an alum. So shout out to any Bison out there.
All right.
And after serving in, I believe it was World War I, he returned to medical school and was the first obstetrician to serve as a first Black male obstetrician to serve in the city of Trenton. And so I really, really loved his story and his commitment to working with communities, especially women in underserved communities throughout his lifetime. And so that spirit of service was something I took with me in my journey at Howard. And I initially really thought I wanted to go to medical school, but I would say where I started to really unearth and better understand this journey in the environmental space was during a service trip to New Orleans post Hurricane Katrina. That is my cat Mimi saying hello. So during that service trip to New Orleans post Katrina, we did some service around the lower Ninth Ward, and I kid you not, it was like 3 to 4 years later, but it looked like the water had receded only a week ago. And so just seeing the stark difference between some parts of the city and the way in which people's lives were able to move forward, and seeing the still rebuilding that folks in the lower Ninth Ward and other communities were still dealing with was an eye-opener for me. And what I better understood at that time was this understanding of climate change and the way that these types of disasters were going to continue. And we've seen them continue in our community across the Gulf Coast, in Puerto Rico, and really even, of course, even my home state in New Jersey when Hurricane Sandy hit just years ago. And so I really wanted to be like, okay, I know medical school is an option and it's something that I really was passionate about pursuing, but I also wanted to marry this idea of what do we do now to prevent some of these issues we're seeing. And unfortunately, Howard didn't have the type of program, an environmental program that was established to really better study these issues. So I decided to pursue a dual master's at the University of Michigan, both studying public health, specifically environmental quality and health, and environmental justice, which really looked at how our communities disproportionately impacted by environmental pollutants, environmental exposures, whether that be issues in our air or our water. What is that nexus of our built and natural environment that impacts our health ultimately? And so I would say from that standpoint, I needed a lot of experience. And I moved back to DC to work at the US Environmental Protection Agency, which I always like to say was a really exciting time. And this was back in 2015 to 2017, which is critical because it was the tail end of the Obama administration. And for those who do not know, the Environmental Protection Agency's mission is to protect human health and the environment. It's simply that. And I'm a mission-oriented person, so that really fit and aligned with my value system and what I wanted to be able to do. So I worked in the Office of Children's Health Protection, looking at the unique vulnerabilities of children and the ways that they're impacted by the environment, specifically with carcinogens, so cancer-causing chemicals in our environment. And shortly into the Trump administration, I transitioned. I realized that the agency that can do so much good could also do a lot of harm when polluters are at the table and making decisions. to not instead of protecting people, protect their profit. And so I moved from there to an organization called Earth Justice, where I currently, it's 4 years in almost, where I work as a staff scientist in our Healthy Communities program on the opposite end of the table, where we essentially hold these agencies like EPA accountable. We often are suing them. It's an environmental law firm. And we're trying to basically get protections for the communities and clients that we work for. So secure stronger protections for our environment, make sure that there's not a weakening of the existing protections that are afforded under the Clean Air Act or the Safe Drinking Water Act, all of these things in place that are meant to make sure people can live healthy lives. So that's a little bit about my journey. And I know I'll talk a little bit later about my work with Black Millennials for Flint, but I'll go ahead and stop there for now.
Yeah, Michelle, I mean, that is amazing. It's such an inspirational legacy. You know what I mean? Like just looking at your family and your family's progression throughout the years, and then the love of medicine, the love of science. I mean, that's just not something you hear a whole lot about in our community, but it's there, right? It's there, and it's not necessarily communicated in mass media. So I just love the fact that we can share that through this platform. What would you say, like for our preteens and our teenage viewers and our younger viewers, like what advice would you give them? Like, say, if I have a passion for this, or if I like doing this, then I might want to consider environmental science. Like, what are the telltale signs of somebody that is like should be pursuing this?
Yeah, really, there is space for everyone in this work. And I also like to call it a movement, because with the existential threat that is climate change, with the fact that there are so many communities, including communities from where my family's from in Alabama, who don't have access to running water, who are dealing with diseases like hookworm that was eradicated, we thought, decades ago. There are still pockets, and pretty large pockets at that, of communities that have been left behind. And so if you consider yourself an advocate, an activist, I have met some incredible creative folks, people who are artists and rappers and singers, people who work in graphic design, people who work in that creative space to tell the story. Because like you kind of just mentioned, a lot of times we don't hear this work. We don't hear about how it connects to us, even though when we don't let it connect to us, we are oftentimes the ones who are most impacted. Whether it be in urban environments, a lot of it's in our rural communities that are able to get the word spread nationally. And so it's really a lot of the youth in this space. There are a lot of youth who are moving around issues of the environment and climate and are really pushing us forward at the helm. But they're doing it in untraditional ways. You don't have to be a scientist to do this work and to care about it. But you do have to, I think, have a spirit around activism and a spirit around service. Because this is a lifelong work. This is what lifelong work and lifelong fighting. Sorry, my cat is like being a little distracting. So yeah, that's how I would say. I mean, and of course, if you enjoy science, there's a huge space for you there. Whether that be, I have an MPH, but certainly with a background in biology or chemistry or some other science, there's a space to pursue this work. But we need people in economics. We need people who are in law, especially, like I said, I work for an environmental law firm. The predominant people I interact with every single day are lawyers. And so there's, again, like this huge space because our environment is all around us. So I would just say, if you have that spirit of service and a spirit of activism and caring for the people who may be more affected than you are, then you can find a space in this work.
Wow, that is, I'm just like mouth open and awe. This is so good. And first of all, shout out to Alabama. I'm originally from Alabama, so shout out. So, we've definitely highlighted a lot on disparities and have really swarmed in on talking about that. And one of the things you said is about finding that connection here. So my next question is, let me know what are some of the common health disparities that are linked to environment. I think that's important to talk about and set the tone for this evening.
Absolutely. And I will say transparently, I have been following you all's Health Disparities series, which I think is excellent work. I love that y'all are bringing so many different perspectives to how we look at health disparities, because at the end of the day, a lot of these issues are not siloed. They're happening in tandem. They're happening outside of silos in our lives. And so I guess some of the ways that I approach this work from the environmental space is understanding that the environment can either be a great benefit to us, but it can also be a great burden. And so I mentioned communities that may be lacking access to proper sanitation and the ways that is maybe impacting a person's daily lives. But it can also be people who are impacted by air pollution or not having access to clean drinking water, people who are living under a legacy of toxic pollution in their backyards, and the ways in which that ultimately works on our health. So whether that is that it can actually increase our likelihood of developing cancer, which is research that I've done at EPA, very well grounded, the ways in which our environmental toxicants can be linked to cancer, but also ways in which, let's say, things in our food, like pesticides, can be linked to neurodevelopmental outcomes. And the way that works in this term of disparities, which understands that there are certain people who are, I use the term disproportionately impacted, who are more impacted by this, who are suffering more. What that means is that these are certain health outcomes we're seeing more predominantly in communities of color, but especially Black communities. I don't like to just use the term communities of color, because a lot of times we're seeing this either in Black communities, Indigenous communities, folks who are still living in tribal communities, but also Hispanic and Brown communities as well. I always like to ask people if they know someone or if they themselves have asthma. And most people, at least especially Black folks, can say, absolutely, I know someone or I've suffered from it. And that is a condition that is also linked to pollution in our environment. Often when we see communities that have been impacted by and have high levels of asthma still today, we can directly link that to particulate matter and other pollutants in our environment. And while we may not be able to say that there's a causal link, we do know that asthma linked to pollution is going to exacerbate symptoms. So that means you might be looking at higher hospitalization rates. You're looking at more missed days of school. And when you think about what toll that might take on people who are supposed to be working or kids who are supposed to be in school, but they're missing classes, you start to see how this impacts our community much more deeply than just the idea of the health harms and the health burdens. So for me, it goes into all of these different media, whether it's our air, our water, our soil, our food, our workplaces. Often it is communities that look like ours who are in conditions that are not safe for us to work, and that there are even ways in which we take home those exposures to our children. And we see that also in Brown communities for farm workers who are more impacted by, again, that pesticide exposure, harmful working conditions. So in the environmental space, it's a pretty broad umbrella. We don't just look at it as the toxics that we think about, whether it be like heavy metals or pollution. It's also, well, what's in our food, and the things that we're buying, our chemicals that we're using and spraying in our homes, all of these things. And we're just seeing these increased links to adverse health impacts in especially Black communities. So I'd say a lot of that, and it extends, it cascades into an undervaluation of the health of communities. And that degradation of health in communities is linked to economic depression. It's linked to, again, issues around access to healthcare, access to nutritious and healthy food. So many different issues are all connected under this umbrella.
Great. You know, it's like you said, it's all connected, and what you've talked about so far really kind of touches on all the little points that we've been making throughout these last really month and a half, couple of months here about the disparities. I want to switch gears a little bit, and because you've already addressed why we should be concerned, but I want to talk about, or could you explain the state of the air report and what does that mean?
Yeah, so that's a great question. And we've talked a little bit already about air pollution, but the State of the Air Report is a publication produced by the American Lung Association. And they're a pretty large public advocacy organization, do a lot of work, but they also do a lot of research. And so this is an annual report that basically shows and tries to track the types of pollution that people are commonly exposed to. So I talked a little bit about particulate matter, but this also includes ozone, things that can think of smog. If you've ever been to LA, and the air is heavy and it's hard to breathe. That's caused by a lot of that smog and ozone pollution. And so this particular report is tracking progress across different cities in our country and seeing if we're seeing improvements. Are we seeing things pretty much being stagnant, or are we seeing things deteriorate? And in a lot of cases, we're actually seeing that there are communities that have still not seen improvements that are needed to be seen from a health impact or health standpoint from those pollutants, meaning the pollutants themselves haven't decreased, and we're even seeing them being linked to other health effects. So for ozone, for instance, that's linked to issues around decreased lung function. It's also linked to other respiratory issues like asthma. And when you think about something like COVID-19, we're especially seeing the ways in which our air and the state of our air pollution, and there's some incredible scientists out of Harvard and other universities like Tulane that have been able to show how the increased pollution in our air actually exacerbates the symptoms and mortality from COVID-19. So folks who suffer from asthma, who are already dealing with that long-term respiratory impacts, are also now we're seeing that they're either getting sicker or they're not recovering at all from COVID. And so there are still many counties across the country, but specifically Black and Brown counties, where the predominant population are Black and Brown, where there hasn't been enough progress on controlling these air pollutants in our air. And so it's a nice longitudinal reporting. You can look at multiple years. You can see a map of all of these different places. I mean, it's a pretty lengthy and robust report, but there's some really good breakdowns of information and the kind of like high level points that I just mentioned. So yeah, I mean, it's a really, one of the kind of documents that, especially now that we have been dealing with COVID this last year, we've seen this Trump administration that was, not doing enough on enforcing environmental laws and protections. We've been able to even see how some of these differences in public policy have made an impact on the state of our air and the country.
Yeah, I know here we get sort of, especially in the summertime, we get these daily smog reports, and sometimes you can literally just look across the city and see the smog. Sometimes you can't even see the top of the skyscrapers. It's so thick.
Really bad.
And it gets really bad here, especially in the summer times. And so they give warnings so there's an air quality report on the news, tells you if you have these conditions, you probably shouldn't go outside for very long today. So, that's a really interesting report to look at, to see where your city might fall on that scale in terms of pollutants. Yeah. And so, go ahead. So, go ahead.
I'm always like ad-libbing, so I apologize. I should.
No, it's fine. We've talked about air. So now I want to kind of talk about water a little bit and water pollutants. So we know that you founded an organization called the Black Millennials for Flint. And we all understand where that was born and why, but can you tell us a little bit more in depth about that organization and what it does?
Yeah, so I love that. I mean, Black Millennials for Flint is definitely a labor of love. And as you were kind of alluding to, we were founded in the wake of the Flint water crisis. So our work began in 2016, but let's remember that the crisis began in 2014. The city of Flint, the emergency managers decided to switch the water supply to the Flint River, which was notoriously toxic water. It wasn't that there was necessarily lead in that water, but it was the fact that there weren't enough controls put in place, that the lead that's already in our pipes, there are literally millions of or thousands of miles of pipes across our country that need to be replaced. And so the pipes that do contain lead and go into our homes where we turn on our tap and drink water, that is where people were being unduly and highly exposed. And so I would say a lot of people before the crisis were thinking that lead was an issue of the past. We got lead out of gasoline, so what is there to worry about? But the reality is lead is a powerful neurotoxicant. It's a heavy metal, so it's persistent. It's not just going to break down in the environment. It's there to stay. But lead has no place in our bodies because it'll actually substitute calcium, which can have really horrible implications for health over time. So we were founded in understanding that there was this issue around environmental justice, this issue around civil rights that people were dealing with. And the fact that it's not just in Flint. There are so many communities, especially in urban environments. You can look at Newark, New Jersey, where I have family. You can look in Memphis, Tennessee. We have work in DC. You can look in LA, in so many cities, and see where there's still this issue of lead today in our drinking water. And so actually our roots in some respects were around working with the Urban League, the National Urban League, as well as the NAACP, of which we were, those who helped to found the organization were members at the time. And we wanted more of a response. We wanted there to be more than just, okay, we need supplies, we need to get direct resources to people. People couldn't shower, and some people still do not shower at their homes today, nearly 7 years later, because there's still a concern about that lead that might be in their water. People still need bottled water to this day. And so there's a whole generation of children who've never been able to just simply turn on their tap, get a cup of water and drink their water. They've lived off of bottled water, cooking and drinking and all of these things. And to think about what that does to a psyche is a whole nother conversation.
So,
But our work specifically with Black Millennials for Flint was.
So Michelle, besides, the communities and the states that you named, as a national issue, like who should be concerned about lead exposure? Like what are some, I guess, telltale signs or some marked, identifiers that you may be being exposed to lead, or how should I be concerned, or why should I be concerned?
Yeah, I'd say we all should have a baseline concern, especially if you're a woman and you have children and or who choose to become pregnant, because if you have even a legacy of lead in your system, it can leach from your bones. I mentioned that it can replace calcium. So when you're pregnant, that lead can actually cross the placenta and it can expose the developing fetus at that point. So pregnant women should be concerned, children, especially anyone with young children. And that's because of that neurodevelopmental impacts. Our developing brains are very susceptible to those types of toxicants getting into our bodies. It's linked to ADHD, autism, other behavioral issues. And so I would say some of the telltale signs or ways you can be thinking about of, well, am I being exposed? If you live in a home that was built after 1970s or built before 1976, there might be some lead dust and lead in your paint, because lead was still readily used at that point of time and before that time to basically make colors more vibrant. So a lot of your whites being whiter, that idea of a white picket fence and white outside walls and white indoor walls. So that legacy of lead is certainly in our homes from dust. That's the number one way people are exposed. And then in your pipes, if you don't know if your pipes have been replaced, if they haven't been replaced, then they are most likely leaded pipes. And so you can test at the tap. Most cities have a program where you can ask to have your water tested without there being any charge. I hope you all can still hear me, because I feel like my computer screen is, it's breaking up a little bit, but hopefully that's okay.
No.
So those are just two ways that you can be thinking about it. So how old is your home? Do you know if the lead pipes have been replaced? Sometimes you can even see if you buy a home, it has to be written into certain contracts in certain states, whether the pipes have been replaced or not. And then some states, or at least certain cities, have really good mapping systems to show you whether the pipes in your home have been replaced, or at least the pipes in your neighborhood have been replaced. And then there are grant programs to help you replace the pipes. But the other thing is to avoid buying toys from like a dollar store. Reality is that we don't have great regulated bodies that can look at imported goods and do the kind of testing we need. So we often see that cheaply made toys that you, again, would maybe find in a dollar store or in a grocery store are painted with lead, because again, it enhances colors. And so that's another way a child could be exposed, is with toys. Testing your soil is important too, because you can track lead in the home based on soil that might be contaminated with lead. So there are, I would say, not to be like grave about it, but there are a number of ways we can be exposed. And again, if you are having young children in your home, even if you're just an auntie or like whatever the case may be, it would be worthwhile to make sure either you've tested your water at least, and or are using a certified filtration system that can, or filter, not a whole system, but a filter that can filter lead if you're unsure, and making sure you're replacing that readily.
That's a lot. That's a lot.
There's a couple other ways, but
I feel like I need to go test my water right now.
Yeah.
I mean, I hate to so, and I always do this exercise with children. But one of the things is I'll take like different bottles, different types of water. I'll say you can see sometimes when water is contaminated, but lead you can't see it, you can't taste it, you can't smell it. And one of the things we've battled with over years is like when a place is put under a boil advisory, for instance, there's often never any mention of like, be careful if you think you have lead in your water because it's a heavy metal. So if you're boiling water, you're killing a pathogen, but you're actually concentrating metals that might be in your water. That makes sense. So that's just we've tried to do a lot around messaging and education for this very reason. In a non-pandemic time, we go door to door and we give information to people. We have it both in English and Spanish. And we've done a lot of advocacy, both at local and like federal levels around laws related to lead. And it's highly underregulated in our country. I think the Flint water crisis helped to illuminate how widespread this issue still is. And I will say, even when I was at EP at the time when the water crisis was breaking, and I recall literally school systems being like, we don't test for lead because we don't want to know, we don't have the resources to remediate if we do find lead in our system. So it can be a widespread issue, wider than we actually know, but I think a lot more communities, especially school systems, are doing more about it these days.
So given that, literally, I mean, all the things you named, you could possibly come into contact with or exposed to lead in pretty much your everyday life on pretty much anything. How much lead exposure is considered dangerous, and how are we measuring that?
So the reality is there's never been an identified safe level of lead. So from our studies and our understanding in the literature, any amount of lead can be detrimental, especially to a child or an infant. So we always say testing twice under 2 for children. That's like a clinical kind of understanding and term. And unfortunately, not all clinicians or pediatricians, let's say, are doing that testing. So a lot of times it's like opt-in. If they think the home environment might have lead in it, they'll do that kind of testing. But you do want to be making sure there's a blood test for children. So that really small amount can have impacts on, again, neurodevelopment. But for adults, it does take a lot more. I mean, you'd have to be almost at the lead poisoning stage, like keloid development, all of that, for you to have any like detrimental effects. But lead is not readily removed from our system. So yes, we can excrete it, but enough of it will actually get stored in our bones as we're developing. So even if it's not impacting you today, it can impact you later in life.
So now I'm curious.
Keloid development.
Yeah, I got questions.
Yeah. The keloid development, that can be linked to lead.
Yeah, if you have high levels of lead, you can develop keloids. And so there's a whole chelation like therapy that helps to remove lead from your body. But that's if you're hospitalized and you've been exposed. I mean, not to sit here and make it sound like it's so limited that this can happen. I mean, there are like high exposures that can happen in a home and like again in lead-based paint and dust. But that's something that can lead to hospitalization.
I feel like just that one question. I know, like when I take my children to the pediatrician, you got to answer that one question of, was your house built before a certain time? The lead question. But after you check, no, that's it. Like yeah. I haven't talked about lead like this to this degree, because after I check, no, there's no other questions or follow up about it.
The surveillance system is notoriously weak on this subject from a funding standpoint, but also from making sure clinicians, pediatricians are really asking and following up. But they should be. And there are what we call pediatric environmental health specialty units that are mostly from medical doctors, medical professionals who are better versed in the types of environmental health hazards that children might come into contact with. And so every region in our country has one of these units, and you can basically get more information from those individuals. There's actually one based in Chicago, which is in Region 5, but then the other region, Region 4 in Atlanta, there's a PSU unit. So there are other ways to get more information, but it's up to, a lot of times up to the parent to be asking and saying, okay, I want to get this test done. And just to make sure that there isn't an issue that's unidentified.
Yeah, I've had it done for all my kids because I live in a home that was built before 1976. And so I'll petition to our mommy viewers that you have to do it. It's necessary. It sucks because the testing is for kids under 2. So it means you have to kind of hold them down while they draw the blood. And, that makes mommies cringe a lot of times, but it's so necessary because when you hear Michelle talk about like all the adverse effects that come along with lead contamination, you want to know, right? So that you can proactively mitigate the issue if you need to.
Yes, that's right.
Yeah, and since it's not very well, I guess, observed or categorized, are there other things that you look for that might tell us that, or are there things that are correlated to lead exposure other than like keloids? Are there certain illnesses or symptoms that a person would exhibit if they've been overexposed to lead?
Yeah, there are. So I would say Flint is unfortunately, in some respects, a case study of where these effects have been seen. So we know that lead exposure can lead to decreased fertility in women. And we've seen that curve. We've seen that trend in reduced fertility rates in Flint. And I won't even get into the stories I've heard firsthand of women losing their children, miscarriages. That data is there. But in children, we often see it manifest as behavioral problems. So as I mentioned earlier, ADHD, autism, hard time paying attention in school. The biggest indicator and kind of measurement we use for lead exposure in children is IQ decrement. So it makes it harder to retain information. And so I even recall meeting a woman who found her child was had extremely high, really high, almost needing to be hospitalized levels of lead, but also at the same time have been suspended. And I know it's going to sound like an absolutely insane number, over 40 times. And he was only in the 5th grade.
Wow.
Now, a child who has, and you'll see a lot of this research, especially going back to Flint, child who has been impacted needs additional services. They need to be in school and being taught under a certain program and not policed, as we often see Black children be kicked out of school, suspended, or put in detention, and other ways in which their education is sidelined when, again, they actually need additional work and additional services. So we've seen that be at play in Flint, but in other communities as well. But again, the predominant things that I would say that are highlighted for children is that neurodevelopmental harm. But in adults, that can manifest as kidney failure, manifests in a lot of different ways. Like lead is just a heavy metal that has no place in our bodies. And so that's why when I mentioned earlier, even a very small amount, we have to avoid it if possible.
Yeah, it's like, Lee, digging into our physiology background, right? When we think about all the things that in our bodies that utilize calcium to function, right? Your action potential, that's your muscles, people. It's your muscles, and like your skeletal muscles, your heart muscle. So many things in your body are dependent upon calcium, and the fact that lead can replace calcium is huge.
Yeah, absolutely. There's research around nutrition that shows, at least if you fortify diets, that can be helpful to decrease lead uptake into the bones. So I don't want it to sound all dire. There's some good work out there showing how you combat these things, but you have to know that there's an issue. And again, I asked earlier, what are some of those telltale signs? Some of it starts at school performance. We saw one of the things that really galvanized us in our movement was, so in 2016, going to 2017, we saw the issues of police brutality with Freddie Gray and Corinne Gaines in Baltimore. They were both severely lead poisoned as children. And so when we think about behavioral functions over time, some of your responses to adverse situations are changed because of your exposure to lead. So it's a really, there's a lot to dig into there. And I think we understand that, like people do understand that. We actually even know how much money it would cost to get lead out of our environment completely, but there has to be, I think, the appetite from our policymakers to actually allocate that money, because truly, if we remove lead in all of the different sources that I named, whether it's on our air, water, et cetera, it's not like it's really naturally occurring. These are all, in many respects, man-made ways that we've exposed people, whether it was a gasoline at one point, or in our paint, or in the leaded pipes, and all of these different ways we've used lead over the years. We now need to get that out of our environment, and this won't be an issue we continue to deal with. And some communities have successfully removed the pipes in drinking water, and that precipitously, drastically, I should say, drops the amount of lead people are exposed to.
So I'm glad you said that, because when the Flint water crisis first happened, it was all over the news, it was all over the media. That's all you could hear about. And so it was important because it was in people's mind, it was in people's faces. Mm-hmm. But now it's no longer in the media, it's no longer reported on, it's no longer a quote unquote hot topic. But these people are still experiencing this situation. So I know you mentioned a little while ago that many people in that community are still having to use bottled water. Can you kind of tell us a little bit more about where that situation is right now in terms of the people themselves, in terms of the replacement of the pipes? Kind of like, where is that process and what is that process looking like now? Because I think it's important that we understand that this just didn't go away simply because the media stopped reporting on it.
Mm-hmm. Say it again for the people in the back. We stop reporting on it. We always say Flint ain't fixed. There is still, the pipes still need to be replaced. It's the only way we can truly get all the lead out of the water. And so there's a caveat here, because the federal guidelines that show sort of this limit of lead that we can have in our water it's not zero. It's higher than that. I'm not going to necessarily get into the level, but the point being that people in Flint cannot deal with any additional lead. So while the Environmental Protection Agency and maybe the state agency, Department of Environmental Quality for the state of Michigan, would say, well, the water is safe in most respects, that doesn't mean that it's at zero. And so there is a deep mistrust of, or I should say distrust of, that kind of messaging around, okay, well, you can drink the water, but they're still replacing, I would say, filters. So making sure people have access to filters, you need to replace them, because they will, if they get too old, they'll just lodge all of the contaminants back to the water. Definitely want to make sure people are replacing filters. But the lead service line replacement is not happening at the rate that it should be today. When that was mandated to be happening, when the state agreed how soon it would be able to remove the pipes, it's not where it needs to be today. And I would say a lot of the work we've done, even with Black Millennials for Flint and with community groups on the ground, is think about beyond bottled water, what are other sustainable water sources available? And so I don't know if you ladies have heard of the Water Box, but it is a water system that was developed under Jaden Smith's foundation, 501c3. It's not super unique, but that's the name of it, 501c3 foundation. He's done a lot of work around water with the Just Water boxes that he has. And so this is a sustainable portable water system that was able to be brought to different entities in Flint. We have a faith-based partner, a church in Flint, First Trinity Missionary Baptist Church, that is one of the home bases for this water box. It allows people to come get a lot of water at one time. It's filtered through the system, and people can go home, don't necessarily need to have the bottled water with them, as has been depended on for the last 7 years. So that is a system that has been in place, but with COVID, it's happening a lot less because that kind of contact is not as safe. And so people have gone back to drinking bottled water and cooking with bottled water. There's this other overlay of, there's a whole settlement happening right now. It's a pretty hot topic though, with the Flint water crisis. And this would be the largest settlement or sort of large case that's happening. There's over 45,000 people who've signed up for the settlement already. a lot of debate around whether this is enough. It's certainly not, even though it would be one of the largest settlements and class action lawsuits in the country. But those are, even the ways people have to prove that they were exposed to lead is egregious. So people are dealing with that overdrive of like, well, how do we now seek remedies and relief from having been exposed to the lead after all these years? And I would say that's one of the other things that we're tracking and helping in some respects to educate people on. But there are still groups that are collecting bottled water and that kind of resource, including the church that I just mentioned. When they aren't able to use the water box, they are still providing bottled water to the community as they get it.
Well, listen, Michelle, this has been an education for us all and for our viewers. And we are, so grateful that you made the decision to join us this evening. We like to close our show with like a call to action for our viewers, right? We want to educate them, but then we want them to act. So can you just tell our viewers what they can do, how they can support you, how they can support Black Millennials for Flint, and where they can find you?
Yeah, so with COVID, a lot of organizations, our digital advocacy has increased exponentially. Like a lot of the work we're doing now is trying to reach people where they're at home. And there's some benefit to that. But a lot of our work, you can find us on social media under blackmillennialsforflint.org, but also BM4Flint is our other handle if you're looking on like a Twitter or Instagram or anything like that. And we're often doing still our educational campaigns. We have a lead ambassador program. So for people, and I mentioned all the way earlier in the episode that we want as many people in this movement with different expertise and different interests, whether you're creative, whether you're a scientist, whether you're in economics or something. So our ambassador program is based in our 4 service areas, which includes Washington, D.C., Memphis, Tennessee, Baltimore, Maryland, and Flint, Michigan. So if you live in any of those areas and you are hearing this podcast, come later this year, usually around July and August, we announced that we have a new cycle of ambassadors. And there's the benefit of learning more about these issues and being able to communicate about this not only to the public, but to policymakers, and basically be a part of our tribe as we're trying to increase awareness around these issues. And thinking about creative projects we can do on the ground, but also online, as we're in this, we're not all outside just yet, even though I'm vaccinated, but we still got a long ways to go there. So that's another way folks can continue to engage with us. We often do also like action alert information and sort of sharing. So our listserv is active in that respect. But just continuing to educate yourself around these things, whether it be about climate change, whether it be about understanding like, well, what's happening in my community, especially if you live in a large city, I guarantee you there is a neighborhood that is not doing so well. They're not getting their access to resources that they need. And a lot of folks have organized around this. So we're not needing to reinvent the wheel or start from something fresh and new, but joining those types of organizations and their fight is another way to support. And then finally, supporting an organization like, or I should say an entity like First Trinity Baptist Church. They're doing incredible work in Flint and still need additional resources. So you can, I would definitely say encourage, look more into their work and support them too.
All right. Well, this ends our episode of the Black Scientists Cooperative. Thank you so much for coming, viewers. And until next time, we'll see everyone later. Good night.
Deep flows like a breeze flowing through me, from my head to my feet. Your love runs smooth, ooh, it soothes, and you're making life right. I'm so glad that you're mine, yeah, 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 yeah.